Welcome to RAAONLINE. So today we are going to see a very important discussion topic. Okay. First, there was a question: what is the difference between a casualty and emergency department? Is it just because the difference of skill and knowledge? Let me explain you, dear friends. There are casualty medical officers who are extremely experienced, trained, and skillful than the new generation emergency physicians. Okay, so it is not about just the knowledge and skill or the experience part. Okay, as far as emergency department is concerned, it has significant additional values than what a casualty is. Okay, the prime most important difference is that a casualty is concerned only within that particular hospital, but an emergency department has the responsibility to handle all the emergency situations in the complete region. Meaning, an emergency department should have a protocol to immediately act at the place of emergency itself, not inside the hospital. Okay, and if at all they get more number of cases, like I'm saying about multiple casualty or even mass casualty, they should have a protocol and a communication and a generalized agreement how to refer a patient, how to transfer a patient to the nearest center as well. Okay, so to have a proper protocol not only about the curriculum but also within the region, all the emergency department has to be tied up together. Okay, so this protocol formation is also a responsibility of an emergency department. Okay, and the first and foremost is pre-hospital care. Okay, today we are going to discuss about the emergency medical services. So we need to understand how this emergency medical services actually evolved. Okay, so nowadays whenever we speak about emergency medicine, we cannot omit BLS, ACLS, ATLS, PALS and other life support courses that has been gifted to us by the American Heart Association, right? So what actually made this kind of trauma knowledge to these countries is that the events which happened in the history. So let us see how this emergency medical services came into action. So EMS is nothing but the extension of emergency medical care into the pre-hospital setting. Okay, before even the patient has arrived into the ER. Okay, or otherwise I can say you at the point where the emergency has happened, at the point where the accident or trauma has happened. Okay, you're going to give a care at that spot itself. So today's EMS system are rooted in legislative and clinical development that actually happened in 1960s and 1970s. So you should know exactly what happened in those years to understand the fruit which you have in your hand now. Okay. So in 1966 report, the accidental death and disability, the neglected disease of modern society. So this report highlighted the deficiency of pre-hospital care of trauma victims attributable to inadequate equipment and improper training. Okay, until that time, more than half of the ambulance services were run by funeral homes. Okay, because those funeral vehicles are the only few vehicles which can transport a stretcher. Okay, so imagine you are hit in the road. Okay, you got an RTA, you are involved in an RTA, you got hit in the road, and imagine that this vehicle is coming to pick you up when you are still alive. Okay, a mortuary van is coming to pick you up, since because only that this is the only vehicle available to accommodate a stretcher. Okay, just think of the situation in those days. Okay, so the National Highway Safety Act of 1966 established the Department of Transportation and made it the lead agency responsible for upgrading EMS system nationwide. Okay, these are the words from Tintinella. I'm not speaking about India. Okay, this is how it got developed in the US and other areas of the world. Okay, that's how the American Heart Association, the trauma care actually came up. Okay, so in 1967, J.F. Patridge began using a physician-staffed mobile coronary unit in Northern Ireland to provide pre-hospital cardiac care. Okay, now in India there is one ambulance called as 108. Okay, how many emergency physicians are actually willing to work inside that 108 ambulance 24/7? Right, in 1967, Patridge tried it. Okay, he tried placing a physician into these kind of ambulances. Okay, physician staffing of ambulance never gained popularity. Either it's been 1960s or it's 2025, it never gained popularity. However, in the late 1960s and 1970s, non-physician personals, they began learning advanced skills. The US EMS System Act of 1973 made available certain grants to develop these EMS systems. They want some fund, right? Approximately 300 EMS regions were established during that time. To receive funding, the act required that EMS system, you should follow this 15 key elements. Only then they'll be recognized as an EMS system and they'll be awarded some grants or funds. Okay. So these systems form the foundation of what you call the EMS system today. So as an emergency physician, it is your responsibility to check whether in your area is the EMS system well established. Is the pre-hospital care well established? Understand, if the pre-hospital care is improper, then it's going to be a clear mess, right? If at all you are able to give a proper emergency care at the emergency trauma area itself, in the road itself, then that is going to be the success of your emergency department as well. Okay, so conducting an EMS proper system management itself is the emergency department responsibility. So as an emergency physician, you should know this 15 key elements. Okay.